be presenting on a clinical teaching plan to demonstrate competencies in diagnosing depression using the PHQ-9. The need for this assessment is because we have 17.3 million adults in the United States that has at least one major depressive episode. In 2017, about 11 million US adults 18 years or older has at least one major depression episode with severe impairment. Between the age 12 and 17 in the United States, we have 2.3 million people with at least one depressive episode. Also, the leading cause of disability for people between age 15 and to 44 is depression. Depression has cost the United States about 23 billion US dollars in loss of productivity annually. So the reason why I am trying to use this teaching plan, or why I use this teaching plan, is because lack of knowledge on screening from nursing students, and it's recommended by U.S. Preventive Service Task Force to screen all ages for depression, regardless of risk factors. So the demographic for the learners for this project is the learners are psychiatric nurse practitioner students between the age 30 to 50. Their educational levels are bachelor's degrees. 90% of the students are African American, 10% Caucasian, and 95% of them are female, 5% male. All speaks English, and there's no cultural constriction identified. The goal of this teaching plan is to make sure 95% of the nurse practitioner students will be able to demonstrate competencies in diagnosing depression at the clinic. My objectives are: one, by the end of the session, students will be able to list 5 signs of depression. Then my second objective is students will be able to accurately administer PHQ-9 tool in 5 stimulated patients. Then by the end of this session, students will accurately interpret the results of PHQ-9 in 5 stimulated patients. Method of instruction will be, simulation will be my main teaching method. Then I will use handout PowerPoint throughout to the lecture. Lecture and video presentation will be done for about 30 minutes. Simulation skill role play will be done for 30 minutes. Group discussion and debriefing for about 30 minutes. These are my review literature regarding this project. We have a literature review showing the importance of clinical stimulation by Jean Land et al. It's a clinical controlled trial where they use stimulation randomly on 392 nursing students, and the conclusion was that stimulation teaching model was able to increase awareness of workplace violence, and it helps the student in gaining confidence in the experimental group compared to the control group. This is the second review of literature by Yang et al. This was to evaluate the quality of simulation teaching in nursing students in fundamental of nursing curriculum. This is a qualitative study, and the conclusion was the application of simulation teaching in fundamental nursing proves high quality and feasibility method in nursing education, helps to improve efficacy and confidence. Then the third review of literature was by Deng and Deng. This was on the influence of high stimulation teaching method on nursing post competency and critical thinking ability of nursing students in high vocational studies, vocational college. This was a randomized control trial done on 110 nursing students. At the end of the study, eye stimulation teaching method was effectively improved critical thinking ability of nursing students in the observation group compared to the traditional teaching method in the control. Then the fourth review of literature, which was done, was on the effectiveness of patient stimulation in nursing education. This was the meta-analysis that reviewed potential 2,503 articles and 20 analyzed on the effectiveness of stimulation as a nursing education tool. The results show stimulation education could guide nurse education and is more effective than traditional methods. So the synopsis of my literature reviews shows that there were differences in the level of evidence of the literature that were reviewed. The commonalities among all the literature reviews was that the population of study were all nursing students. Synopsis of literature review also shows that all studied agreed that stimulation teaching is the most effective teaching method, and it improves critical thinking. Because it improves critical thinking, self-efficacy, and confidence. So I'm choosing this method as a method of teaching for this project. Also, learning theory that was used, I used the functional context theory. And my philosophy of learning is that learning is an active process whereby knowledge is constructed. Education can best be experienced by building on one's personal experience and past knowledge. This is integrated with my teaching plan by providing learners with handouts, simulation through role playing, so that they can assimilate new information from personal experience. This simulation is appropriate because simulation teaching is very effective for nursing students, and my learners are practitioner students. So simulation was found to improve critical thinking and efficacy. So this was my chosen method of teaching. So the teaching content, my objective one, which is the students will, at the end of the session, the student will be able to list 5 signs of depression. This content was to teach the disease symptoms, and method of presentation will be by handout and lecture. Allocate 30 minutes, and the references below it shows where I'll get my information from. Objective 2, by the end of this session, students will accurately administer the PHQ-9 tool in 5 stimulated patients. So the content will be how to screen the patients. My learners, which are nurse practitioner students, will present through simulation, role, lecture, and discussion. 30 minutes will be allocated to this, and I have my references on how to screen the patients and the tool, the PHQ-9 tool here. My third objective is by the end of the session, students will accurately interpret the results of the PHQ-9. The content here is to diagnose depression. Method of presentation will be stimulation and role playing. Time allocated will be 30 minutes. And I have my references here from Center for Quality Assessment on how to interpret the score accurately. I will be evaluation will be done after the evaluation will be done after the presentation by having the learners fill some questions, which is post-test questions. Post-test questions will be: what are the common signs of depression? What are the maximum scores on each row on the PHQ-9? And what are the score ranges on the PHQ-9 for mild, moderate, and severe depression? This is to check how effective or to check their knowledge of the teaching. This is an example of the evaluation survey that the learners will use to evaluate my presentation. My questions will be how well, ask them how well will you rate my presentation? How did my presentation accommodate their backgrounds? How well did the presenter state the objective? And at the end, I asked 2 questions at the end for open-ended questions, just to let them say what they feel regarding my presentation. These are my additional resources that could help the learners in understanding depression signs and symptoms from NIH, the PHQ-9 screen tool from the US Preventive Task Force, and the PHQ-9 calculation to help and interpret and diagnose. These are my references, and thank you very much.
Great job, Deepo.
Thank you.
That was really useful. That was great. As a psych NP, I really appreciated listening to that.
Yeah, I appreciate you saving me from
yeah. No problem. I'll go ahead and stop the broadcast, and then I'll just call you back.
Okay. All right. Thank you.
Okay, I'll send you the link.